Well, Australia's COVID-19 vaccine rollout is feeling very real this morning, with the federal government officially launching a $24 million advertising blitz to encourage Aussies to get the jab.
COVID-19 has changed our lives. For us to live more freely, we need the added protection of COVID-19 vaccines.
Our experts are looking carefully at the clinical trial results, along with all the data on quality and manufacturing of the vaccines. We only will approve vaccines when we have enough evidence that they work and that they're safe.
The rollout of the vaccines will be available in batches, so we're making sure they go to where they are needed first. To keep up to date, visit health.gov.au.
And Chief Midwifery and Nursing Officer Professor Allison McMillan joins us now in Canberra. Professor, thank you so much for your time this morning. Look, we've had very shocking and memorable public health campaigns in the past, like the Grim Reaper when it came to HIV. When we're talking about saving lives here, do you think this is really going to have the impact that we need?
Good morning, Ali. Yes, I think that we can. We're building the confidence and providing information to the community about this vaccine as we commence the rollout. So we need to be very transparent and provide the information they're looking for to have confidence in the vaccine program that we're about to start.
I think we've been hearing this information coming from our health officials day after day, and I guess one of the things I think perhaps we were expecting to see is for there to be more of an emotional connection with this ad. You know, perhaps people in ICU units, so for it to have that impact on people to realise that they've got to step up and do their bit.
Well, I think, Ali, we used some of those aspects in encouraging people to do the right thing, and we want people to continue to do all of the things we've been doing so successfully. But I think when it comes to a campaign, we know that Australia is one of the most successful countries in vaccination in general. We know that people, if provided the right information, will make the choice that's best for them. And I think that's our intent here, is to provide the information so people can make a decision for themselves.
There is so much misinformation out there, as you know. Do you think you can turn around the doubters, the sceptics?
There'll always be people who are sceptic about this and acknowledge their right to have to make a decision for themselves. But I think it's important that people go to where the credible and reliable information is, and that's why, as you heard in the advertisement just now, we're encouraging people to go to our website where they can have confidence the information is transparent and we're providing it to them.
So there are certain phases of this campaign. Can you just talk us through what of those key messages each of those phases is?
Well, we've already been running a campaign, as you know, Ali, for now a whole year in relation to COVID-19. Now we're starting with television advertising, social media, information to all of our health professionals, be written, be on websites. Every channel we can possibly think of, we're providing information to the community and answering questions as they come along. So the rollout will continue over a period of time, and as different groups the vaccine becomes available to different groups of the population, we'll be telling them where and how they can get the vaccine. But as you know, our priority for now is healthcare workers.
There seems to be a lot of concern, particularly from young women, about the long-term effects of the vaccine. Is that fear warranted?
I think that everyone should inform themselves with reliable information. I think that we also know that young women are often good to take up the vaccines, and vaccines when that information is available to them. Again, I encourage everyone, get informed, be informed, and make the decisions for yourself.
So what's tougher, getting people on board or the logistics and actually rolling this out?
Oh, I think the logistics are pretty tough too. I think that particularly with the Pfizer vaccine, with its need to be kept so cold, we're working through all of those. And as you know, we as a Commonwealth Government are leading that distribution program. You know, we're going to learn as we go. The great advantage we've got is others have done this before us, and we can learn from what their experience and what they've been able to do.
Are you confident that the majority of Australians will get the jab?
I am, and everything we're hearing and reading at the moment is suggesting that will be so. Obviously, our focus initially is on residents in aged care facilities, healthcare workers, aged care workers, and those working at the front lines, such as in quarantine, and over the coming months it will be rolled out to the broader population.
And just speaking about our elderly, because the AstraZeneca vaccine, there is issues with it or concerns that you haven't tested it enough on the elderly. Does that bother you, and is that a fair concern?
Ali, we use, as you've heard already, we use ATAGI to provide our advice on the data available to us about the population groups we should be vaccinating. ATAGI has not yet completed its work on the data available on AstraZeneca. When it does, it will give its recommendations based not only on the evidence that's been provided in recent times, but also the experience across the world. So I'm not going to speculate on what ATAGI will say about AstraZeneca. We'll wait to hear what they've got to say for us.
All right, Professor, thanks for joining us this morning. Let's hope the campaign works.